Thank you so much for this opportunity to present. It's been a great morning and afternoon of presentations. I'm going to present on behalf of the Zimbabwean side and the Zambian side. So just briefly to remind each other who we are, and I'm not going to talk much on this slide, but to just highlight that our Sickle hemoglobinopathy research group consists of a site in Zambia and a site in Zimbabwe. They're hosting universities, the University of Zimbabwe, and we're working with Parenyato Teaching Hospital and the University Teaching Hospital in Zambia. In terms of the task that we were asked, information that I'm going to share with you, in terms of our data management expertise for I'll start with the Parenyato Teaching Hospital site, which is at the University of Zimbabwe. Well, we use RedCap for practically all our projects in the university. We've been using RedCap database since, I think, 10 years ago. And well, I like to say I'm proficient. The other members of the team are also experienced, but we do have some members who need training with basic proficiency. In terms of the investigators, we've got a wide group. Some are very proficient, but others also require training. In terms of the Zambian side, the co-PI from Zambia is quite proficient when it comes to using the database, but the other investigators will require training and more training. They are still recruiting their staff who also require training in terms of running a research program on the database, on the RedCap database. In terms of infrastructure, at the University of Zimbabwe, we have IT capacity, which is not, well, no longer up to date. This equipment was acquired 8 years ago, may need upgrading, but for now, it is deemed to be sufficient. Looking at the use in the university, it's still performing quite reasonably well. Our servers have a capacity of about 4.2 terabytes with 24 gig RAM, but they are now better servers and with higher RAM and much higher speed. And in this day and era of virtual, almost everything is now being done virtually because of the COVID. One needs to have access to very good IT support. Our servers are actually hosted at a commercial center, which is quite secure against physical or any fire or cyber security. And they automatically back data to the system, but there's also an offsite backup system, which is housed at the Petra offices. But we are encouraged by the administrator that if we are able also to back up data, it's good practice. The database manager is called Miriro Muvoti. She has a bachelor in engineering and an honors in electronic engineering and also an MBI. And the university basically has been running some RedCap trainings twice a year. Unfortunately, because of the COVID pandemic, they can no longer do on face-to-face trainings. So they've migrated to a virtual training, but they are complaining that it's not the same than a face-to-face where you are actually interfacing with the participants who are being trained. But we will work with what we have. At least they now have some experience to do virtual training for RedCap database use. And then we do have, we've acquired a few gadgets to use for our project. We'll be happy to get more if we could. But for now, I think this will suffice because we're just piloting to see what will work before we then actually go into recruiting many more participants. So we're just doing a dry run. And however, at UTH, they still are setting up the office. We did take some time to set up the sub-award, but after the administrative red tape, it has gone through. They've received their initial funding, and so they are busy trying to recruit their research staff and to set up their office. They also have access to computers and laptops in the university teaching hospital, and all the investigators in the project have access to the computer facilities and the internet network there. And I'm given a report that the facilities, they represent 24 hours, 7 days a week, dedicated fiber optic internet connectivity. So they have, they are good to go. In terms of our recruitment strategies, somebody has already talked generally about the different types. So currently, because we are running a pilot, we are just actively recruiting from our hematology outpatients clinics at the perinatal teaching hospital, in the pediatric clinic and the adult clinic. And the research assistants actively screen and recruit participants from this clinic and collect data. The physician investigators have been assisting with also identifying patients who come through the emergent services and are admitted directly to the wards with sickle cell disease. After the pilot phase, and we've reviewed what is working and what is not working, we hope to actually come up with developing a project advertisement material, and we are going to be sending this advertisement material to the rest of the departments in the group of hospitals, because perinatal teaching hospital is a big hospital with many other hospitals within it, including a big maternity section, including a big surgical department and pediatric department and gynae obstetrics. So we'll then conscientize everyone so that they know that this project is happening. But we also have 10 kilometers from the PTH, another big tertiary hospital that serves Harare, the capital city. We also plan to conscientize them about the project. Next year, in the next implementing year, we plan to establish outreach sites in the 3 other provinces with a high burden of sickle cell disease in Zimbabwe. That is Marsh East, Marsh Central, and Marsh West. So we'll recruit outreach workers, and at that point in time, we are hoping some of our projects will be going on, particularly the newborn study, which can help us identify using mass screening. And then in UTH, it's almost similar, but they have a much more bigger clinic. Their clinic is attends to both adults and pediatric patients in one place. And they will have 3 main research workers who assist them with data collection, but they're going to try and, because this big hematology center already is looking after many patients with sickle cell disease. So the plan is to utilize the doctors in training that are attached to that unit and the nurses to see if they can be trained and assist with data collection. Obviously, that comes with its own issues, but we hope with training, we'll be able to maintain the data quality. But we'll see as we go. They will pilot it and see what they can improve and what can be implemented so that we can collect good quality data. And then really, they are looking at sustainability. So they want to make data entry a routine activity. And there's no provision. There's also, they have a provision if they are not able to meet the targets for registry recruitment, there's a provision that they can open an outreach site in the northern parts of Zambia where sickle cell disease burden is even higher than in Lusaka. In terms of data quality processes, like we said, we are just starting. Both our sites require support. And we hope SADC will train us and help us so that we can collect robust data that is usable. Currently at PTH, like I said, we are piloting. And so we initially actually had a paper-based so that the research staff could get used to the actual tool, but now we have moved to a mobile project using the tablets. They collect data direct onto the tablet, but before it's uploaded on the server, it's then checked. But we are, like we said, we're still setting up and developing our processes. UTH, they are still trying to set up so that they can start collecting data. Both sites have IRB clearance to collect data. So far, we have encountered a few challenges. We also have a bit of lessons that we've learned. As a new site, recruitment is still slow as we establish ourselves, our systems, as well as us trying to integrate what we are doing into the hospital systems to maximize the recruitment. And then in terms of, we're still working on our data sharing agreements. They're still to be finalized. Zambia has a clear national policy, which they've shared with Zimbabwe. We are still engaging our national research regulators, but it's work in progress. I think it's something that is actually progressing well. And then we've experienced the COVID challenge. I mean, some of the people who we were working with and writing up the grant have passed on because of COVID, which has been very difficult. And sometimes whole research units have had to close down because of people having COVID in the unit. So it's a challenge, but we shall have to learn to live with COVID. It's going to be with us for some time. But though it's been a big challenge, it has also, I think, expedited the virtual business. I mean, from the beginning, we were able to hold virtual meetings as we were writing the grants, the 2 countries. So it has made it very much easier for us to use these tools for meetings, for training. We've learned a lot and how to use Zoom efficiently and run meetings and workshops on Zoom. So we hope to harness what we've learned to use it to train and to keep these 2 sides working together and improve the coordination process. Other challenges, I think, that I didn't write there, actual physical loss of gadgets. Because of COVID, people sometimes have to work at home, and you take the laptops, the tablets, to take it home, and then there's a robbery. So we have quickly learned that we need to insure all our gadgets and make sure everything in the office is insured so against loss. And then just to highlight some of the research that's currently happening, that's about to be published. And then there are several publications from Zambia. Zambia also is hoping to apply for permission from ASH and to then publish on their data from the CONSA project. I hope it will be, ASH will be forthcoming, and thank you. That's all I had to share with you this afternoon. And I would like to acknowledge our sponsors, SADCC and the Clinical Coordinating Center and the research teams at UTH and BTA, and my core PIs. Thank you very much.